Welcome to today's episode of Buildings Hub Live, where we spotlight the change makers and technologies leading the charge to electrify our built environment. On our podcast, we tackle the multifaceted issues facing building electrification, from space heating to water heaters to electric cooking and beyond. On today's episode, we'll sit down with Brady Seals, manager at RMI's Carbon Free Buildings program, and Ruth Ann Norton, president and CEO of the Green and Healthy Homes Initiative, for an important discussion about the intersection of public health and building sector decarbonization. How will building electrification impact the physical and mental well-being of people across the country? Stick with us to find out. Here's your host, Atlas Policy Analyst, Zach Strauss.
Good afternoon, everyone, and welcome to the 6th episode of Buildings Hub Live. My name is Zach Strauss, Policy Analyst at Atlas Public Policy, and I have the pleasure of being your host today. For today's episode, we'll sit down for an important discussion at the critical intersection of public health and building sector electrification. What are the short and long-term health impacts of gas stoves and other fossil fuel infrastructure like furnaces and boilers? What might be the positive health benefits of electrifying your home or your workplace? Stay with us to find out. But before we jump into our discussion today, a quick note on Buildings Hub. Here at Atlas, we manage a one-stop shop data analysis tool for building sector electrification called Buildings Hub. If you're interested in current fuel prices, state policies and funding programs, the current makeup of the U.S. housing stock, federal grant opportunities, we have you covered, and so much more. Check it out today. We love to have you join the Buildings Hub community. We even put a link to the site here below. Check us out. Now, for today's event, we are currently live on YouTube, LinkedIn, and Twitter, and we encourage our audience to send us over your questions, and we'll put them in as we go along. You can do so through the Q&A portal through our YouTube channel. We look forward to hearing from you throughout our episode. It is now my distinct honor to introduce our superstar speakers today. We are joined by none other than Brady Seals, manager at RMI's Carbon Free Buildings program, and Ruth Ann Norton, president and CEO of the Green and Healthy Homes Initiative. Welcome to the both of you, and thank you so much for being here today on Buildings Hub Live.
Zach, I'm so happy to be here and be with that rock star, Brady Seals.
Absolutely. Thanks both for being here. We have a lot to cover today. We only have about half an hour, so let's jump right in. We're going to start with a high-level question. So from a top perspective, what is y'all's role in the building electrification and public health space? What do you do at your respective organizations at this vital policy intersection? And let's start with Ruth Ann.
So Zach, I run the Green and Healthy Homes Initiative, and what our entire mission is around closing the gaps on racial and health equity and addressing social determinants by making homes healthier. In short, improving how we look at the standard of housing in our lowest income communities across America. And what we learned early on, about a decade and a half ago or more, is that for all the money we could put in for lead hazard control, asthma reduction, trip and fall injury, if we didn't address energy, we were losing families to economic stress, turnover, and our own investments were being degraded. As we went over time, we understood that weatherization was so critical to this, and even more importantly, lowering carbon emissions on respiratory health, neurological health, cardiac health, and electrification on market value of a home, which matters in closing those equity gaps, but also in housing stability and fire safety and those types of things that are so important, from taking housing from being unhealthy and obsolete to being resilient for the future.
Thank you so much. Looking forward to hearing more about what makes a home both green and healthy. Those two things are definitely helping to come together. Over to you, Brady.
Thanks, Zach. And it's so great to be here with you and Ruth Ann, who is the true rock star on this call. I'm Brady Seals. I work at RMI, formerly Rocky Mountain Institute. We're a 40-year-old nonprofit organization focused on the energy transition. So we have a program for almost everything. I'm on our buildings program, and I lead a work stream on the health and air quality co-benefits that we see when we electrify our buildings.
Thank you. Excited to dig deeper into the work you've been up to. Over to Ruth Ann. So you are the president and CEO of the Green and Healthy Homes Initiative. Can you explain to our audience how public health and building electrification are related or intertwined? People may not always put the two concepts together, but can you draw a through line for us and our audience today?
Sure. And we work in places around the country. I mean, some of our programs, by the way, when I start to say this, are actually operated out of hospitals in Memphis and in Lancaster, right? We are teaming up with utilities and utility boards as well as healthcare. And here's what matters to us. When we electrify and move people off, like Corliss Phillips here in Baltimore, when an older adult in Baltimore who we moved off of her gas stove, her water pumps, right, and moved her home to fully electric, that means that the asthma that her grandchild may have goes down precipitously. It means that the house is better equipped for all of the other investments I talked about, right? That intersection of health and safety, like lead hazard control and mold and mildew reduction. But here's what it really translates into. For families, as we move into decarbonization, electrification, that significant reduction that RMI showed, sorry to steal this from you, Brady, a little bit, but that 24% reduction in asthma, right, coupled with other healthy housing aspects, for us, we demonstrated for the U.S. Department of Housing and Urban Development in Baltimore, a 66% reduction in hospitalizations for respiratory disease. But we also demonstrated a 62% increase in school attendance and a significant decrease in housing turnover because we're creating much more stable environments. When we think about healthy housing, part of it is affordability, accessibility, right, and stability. And we went from turnover rates of 42% in the cohort of 240 families that we looked at, from 42% down to 6% turnover rate. That's emotional health, right? That's mental health. It's economic health. But as I said, electrification also has to deal with reducing those carbon monoxide emissions into the ER. It has to do with reducing fires, right? And improving those other things around market equity. But housing stability itself has such an impact on human health that we have to take that into account. We also, when we are doing this intersection, we know that we're improving cardiac health by about 16 to 19%, and we're extending life expectancy. Unhealthy housing, which includes poorly electrified housing, poorly weatherized housing, high carbon emissions, there's a 42% increase in early mortality. So this has to do with quality of life. It has to do with economic dignity, right, of wealth retention and stability. But it has a really direct impact. We talk most about the respiratory health, but we have to think about neurological health when you have carbon monoxide involved, cardiac health, and organ development in and of itself. So pretty profound reasons to take this and align these elements together. And we today refer to the standard nationally is 8 elements of healthy housing. But for us, it's all the 8 elements of toxic free, dry, clean, et cetera. But you add the 2 of decarbonization and electrification, and there you have true health, economic, and social outcomes.
Well, that was incredible. Thank you so much for also providing those statistics. And it really seems to me it's a holistic benefit to any person that's electrifying. And I think about the mental well-being as well. I just moved, and living in a healthy, stable, and safe environment really increases your well-being both physically, but also mentally and emotionally. So thank you for adding that as well. I appreciate that input. Over to Brady, I know that Ruth Ann alluded to this earlier, but so much buzz has been generated around the negative health impacts of gas stoves in our homes. And even the federal government right now is soliciting public comment to gain a fuller understanding of this topic right now. But your work in this space has gotten a lot of attention in recent weeks. You co-authored a recent release report tying childhood asthma to gas stove use. Can you tell us more about that study, your motivation for doing that work, and the outcomes of your analysis?
Yes, gas stoves are having their moment and just only 50 years too late. So, the fascinating thing about this buzz is that nothing is new. We have over 50 years of studies, 50 studies themselves showing that there's a real link between gas stoves and human health, with the strongest evidence being children's health. And so we knew at RMI, we've taken a lot of the literature, put it together, put out a report in 2020, just synthesizing, here's what we know. And then recently we thought, okay, it's been a few years. We know gas stoves are bad for health, but how bad? And what we wanted to try to do was quantify it and put it into context. So we partnered with 2 epidemiologists, experts in the public health field, and we did a very simple, straightforward calculation. We took the percentage of households with children in the US, which is actually higher. 43% of households with children cook with gas in the US, which is higher than at the time. 35% was the latest number we had. And then we used the numbers Ruth Ann was alluding to. So 42% increased risk of asthma symptoms, which is what a meta-analysis, what the literature shows us based on all the previous studies, is a child's risk of asthma. So we had these 2 numbers, we put it together, and what we found is that we can estimate that about 12.7% of childhood asthma in the US could be linked to gas stoves. So this is our best estimate given the literature, given how many households cook with gas. And the interesting thing for us when we did this, talk about putting it into context, is that's a similar risk profile for a child who lives with a smoker. So a child's risk of having asthma is similar to having a gas stove and being exposed to secondhand smoke. So this was a basic calculation to help get us some more context, because gas stoves are not regulated. They have free license to pollute. And we feel that it's high time, based on the literature, to do something about it. And exactly like you said, what we couldn't have anticipated was the media frenzy. There have been over 25,000 media hits on gas stoves in the last 2 months. I've had friends and family, probably all of you who work in the building space or have an interest, have people hearing about this. And I think it's more that people are often hearing about these health issues for the first time, less than, the methods of the study. Because again, this was all based on peer review science. Unfortunately, we have found gas stoves in the center of the culture wars here in the US, but the science is clear, the facts are clear, and the recent polling that we're seeing suggests that this is having an impact. 60% of parents now saying they would consider switching from gas stoves to electric stoves based on health. And I think this is really key. Even 40% of Republicans saying they would consider switching from gas stoves to electric based on health. And I think this is such a opportunity to show, and the work that Ruth Ann and GHHI does is often we'll feel the health impacts before we feel the climate impacts. And this can be a great messaging tool and a great way to bring people into healthy retrofits who may not be coming at it from the climate angle.
Can I jump into that just a second? Because what that inspired for us, right, is we have a program in Baltimore that we are doing several thousand houses, but 1,000 in a concentrated footprint, where we have ARP funding, congressional funding, philanthropic funding, HUD funding, right? We're doing this whole house approach, not only here in Baltimore, but with the Board of Public Utilities in New Jersey and other places that we're looking at this. But what we are able to do at GHHI is we are certified to be able to do patient analysis. So we are going to be taking the houses that we electrify and decarbonize, and we're going to actually take patient records like we did on that HUD study that I referenced, and we're going to be studying against not only children, but residents with respiratory health issues, COPD, asthma, et cetera. And do we see improvements not only in symptoms and use of medications, right? But the ER visits, the hospitalizations. Why? Because Medicaid and every health system that is wanting to lower asthma, the community guides at NIH and at CDC and at EPA, right? They talk about mold, mildew, pests. What they don't talk about is carbon emissions. Our goal is that a measure to reduce asthma in the Medicaid and in the healthcare world, do we have the evidence to define that so that Medicaid managed care on a value-based basis can start to pay for those reductions? You can use children's health insurance program, SPA dollars to pay for those reductions. Should this be something that we more likely integrate as a health measure, right? As for asthma programs across the country. And we have to build that patient evidence. And for every healthcare system that then wants to get advanced social determinants of health investments, decarbonization and electrification have the business case that is being built that clearly centers it as a health measure. It's important for climate, right? And I will just end this by saying, I think that the opportunity of the Inflation Reduction Act and all of the investments in climate right now should go largely into low-income occupied housing, partly for health, partly for climate, but it's also an opportunity for restorative justice for historically disinvested neighborhoods. And we will be able to build the health and resiliency and move people off of federal programs like LIHEAP and others if we're able to build their health, their economic health, and their resiliency and build them so they too can have better opportunities in the future.
Thank you so much for that added value input. I'm excited about the combination of both it being a climate issue but also a health issue and really building that bigger tent, right? You said 40% of Republicans are interested in this too. I think that is a really important sea change, and that it's not going to be a left-wing climate issue, but really about how do we improve the health of our children, the health of our families, creating healthy homes. So that I am excited that pivot, I think, is going to be really critical. Let's stick with Ruth Ann to talk about a similar study to what Brady and her team were able to conduct. But I recently saw an affordable housing in the Bronx in New York City, where a subset of households was given the opportunity to switch from gas stoves to induction cooktops. They saw higher indoor air quality and overall health outcomes. So based on that information, how could you tell us that how is equity fundamentally interwoven into the intersection of public health and electrification? That's like at the core of what you do. So I'd love to get your take on the equity conversation here.
You know, in that study, they showed a 35% reduction in nitrogen dioxide, right, NO2, and also where when we moved from gas to induction stoves, or when they moved there, just significant improvements, right? What we have to really think about is in all of these many red line communities where we have where we've not enforced housing code, where we've not brought investment into those communities. In Baltimore, we call it the black butterfly, right? In New York and the Bronx and in many areas, same and similar disinvestment that's happened. So you have aging, obsolete housing where you have leaky stoves, you have poorly weatherized housing, right? This is what I was talking about. In fact, a bit of a restorative justice approach to this is also an economic justice, not only for the communities that we invest in, but for all of us. We will create better opportunity and better pathways for kids to get in a classroom healthy and ready to learn because they're sleeping through the night. They're not in the emergency room, right, for asthma. If we can reduce that 12%, maybe higher on this impact, right, and do that holistically, right? When you go in, make sure you're looking holistically at this housing stock. We know from the weatherization field that in order to properly do weatherization, you have to address lead, you have to address mold, mildew, and moisture, you have to address leaky roofs. This goes for electrical upgrades, right?
Mm-hmm.
You have to do those things in order to be able to upgrade the electrical system in a home. When you do that, you are really changing that quotient about kids' reading ability, their ability to be in school, school attainment, graduation, long-term earnings. It also affects other adults, pregnant women, right, who are really susceptible to environmental health hazards in the home. But one thing that electrification does for the home is a really significant upgrade in market value in a way that builds intergenerational wealth transfer. There's an 8-to-1 gap between the African American, black and brown communities and the white communities in real estate transfer value in terms of equity, right? So not only is there an appraisal gap, there's an actual disinvestment in housing in communities that we can help change that future for intergenerational wealth transfer, and that builds into the next generation of important things. So I think this is really critically important, and what a historical opportunity to also say the mistakes, the ill-conceived policies and bad judgments we made in the past, we can actually invest and have such high return on investment, right? So just in the lead, investing in lead in housing and preventing lead poisoning has up to a 221 to 1 dollar ratio. Investing in asthma has about a 14 to 1 dollar ratio on return on investment to families, to health systems, to education systems, to society. And those returns on investment are something that has, in our field, has always been bipartisan. We've had strong support from Republicans and Democrats around making people healthier in their home. I think this could be very important for the United States to find common ground on this work together.
Thank you. The more I hear you talk, the more I hope that you'll testify before Congress on some of these issues. I think you would really get through to some people. I think that would be, I'm listening to you, I'm like, wow, they should be sitting in one of those chambers talking to senators. We do have.
Well, I did the Senate Banking Committee this year. So.
Oh, exciting. Well, I hope we can see both of you go out and do it again. We have a question here from our colleague at ICF, TJ Rizzo, asking us about Brady, in particular, your research, if gas stoves, is the data and the analysis you found, is that just particular to the gas stoves, or is it also the poor ventilation in the kitchen itself? Where does ventilation fit into this as well?
It's a great question. We know for sure that exposure to pollutants from gas stoves are linked with these health impacts. And unfortunately, ventilation is an imperfect solution. Many homes don't have ventilation. Just to give you an idea of how complicated it is, I live in Boulder County, Colorado. If you live in the city of Boulder, you have to have a range hood vented to the outdoors. But if you live in Boulder County, but not in the city, it doesn't have to be vented outdoors. So building codes and whether or not there's a range hood that's vented is a patchwork. There doesn't exist a database on how much ventilation. We also know from studies that many range hoods aren't effective at removing pollutants to levels that would be safe for individuals, particularly children. A lot of this is coming out of Lawrence Berkeley National Laboratory. So certainly ventilation can be helpful, but we also know from a study recently from National Center for Healthy Housing that Whole home ventilation, for example, even if you're building up to the best, may not be enough to actually reduce the nitrogen dioxide, which is one of the respiratory irritants we see with childhood asthma. So certainly it can be helpful, but the research does stand on its own on effects regardless of ventilation.
Thank you very much for adding that. One of my colleagues just mentioned to me, they raised her rent, and I asked her if they had ventilation. She said no. And I said, well, that's something you should definitely bring up, because that is a health hazard to you and everyone living in your home. So,
and if she's a renter, most housing courts, you can take that action to housing court and challenge the standards there. And we encourage people to do it. Happy to talk to her.
Thank you so much. That's helpful. I would love to learn more about that, especially in a place like DC, which has strong tenant rights. But
absolutely.
So Ruth Ann, you mentioned this a number of times in our discussion today, and these are the other, what I'd call pre-weatherization issues, such as mold, asbestos, lead, unclean water. How are those things connected to building electrification and weatherization for those who may not know? So people hear about lead in lead pipes or lead paint, right? How are those things that we've talked about before in different contexts, how does that relate to what we're talking about today?
Well, one is a common sense approach that when we go in to do one asset upgrade in a home, we should look comprehensively at the home for the health measures that we want to improve together, right? And it's a better program for governments to deliver this together. And in fact, we're working on a blueprint for the Washington, D.C. on how do we have a more comprehensive healthy homes program. It's what the New Jersey Board of Public Utilities is looking at. We're working with them to do a demonstration program in Trenton that looks at this whole home approach. It's what Pennsylvania just passed as law. It's the whole grounding of GHHI, is that you have to look holistically. So the premise for that originally for us was a couple of things. We were investing in lead and healthy housing and finding that 23% of the time where we were investing in Baltimore, people were moving because of energy bills, right? Just their old and obsolete systems, energy bills literally going out through the roof. Over time, we understood the health impact of doing that work, right? Adding into that non-energy benefit, the co-benefits, right? The net benefits of opportunities for reinvestment in that. But for many of these jobs, right, when you go in to either weatherize or improve energy efficiency, and certainly when you're looking at doing the electrical system upgrades, you can't have leaky roofs. That's a health hazard and a risk that will stop the job. For weatherization in Baltimore, Detroit, Atlanta, when we looked at those deferral rates at the time, we did a study for DOE a good ways back now, but we were looking at 52 to 62% of the time, there would be a deferral, a delay, or a decline because there's lead in the home, because there's mold, because there's structural defects on the pathways of even where the workers would go in to do the work. But you can make a home fully electrified, but if it's peeling down with lead paint, you haven't fixed the leaky roof, you haven't fixed the pest management problem, right? You're still going to have unhealthy people. The goal here is the co-investments that allow the larger investment around energy efficiency to actually move forward and be approved. You have to do those health and safety measures. But the bigger issue is, why the heck wouldn't we do it? It improves the delivery for government by about 20%. So because it's more effective and more efficient to do an integrated approach. We know people will be better off. They'll be more stable in their housing and more likely to be in those homes that we've improved from an electrification standpoint and a health standpoint, and benefit longer and better from the health outcomes. So there's an economic case there. There's a health case, obviously. And there is just a common sense and moral compass case around this. But you need to do lead, mold, pest management, ventilation issue, right? You have to do that to maximize the decarbonization and electrification benefits.
Thank you very much. Yeah, I see some state legislatures passing or creating specific grant programs or funding deposits to support pre-weatherization health hazards as well, to help those households who can't afford to do that first. If you can't do that first, you can't do the next steps. So I think that's something we hope to see.
That's the whole premise behind Nikki Saval's bill in Pennsylvania, is that work, right? And it is something that DOE and HUD, I think, should develop a much larger program to get the baseline housing ready for climate improvements.
Thank you very much. We are at our lightning round. It's a tradition here at Buildings Hub Live where we cap out our conversations with a big question in 1 minute or less. So I'll start with Brady. So in 1 minute or less, what is your vision for the future of healthy green homes? And what hopes or actions do you intend to see from the government in the next 5 or 10 years?
Okay, every new home is built all electric, highly efficient, and without the health hazards. We know how to do it, and we know we can do it cheaper. So that's the easy thing. We can do that fast. I would like to see what we talked about before, people feeling safe and healthy at home, not having to worry that their appliances are giving off pollution or that their pipes have a problem. And that we have an opportunity with the climate bill, the IRA, for homeowners incentives to go ahead and take advantage, to make those decisions, to have to want to make the changes. But we need our policymakers to make sure that public and affordable housing, those who rent, those who are affected the most, are benefiting first. So has to be good policy, plus people wanting to use these incentives to make that change for existing buildings.
Absolutely hoping to see some of those rebates roll out this year from the Department of Energy and the state. So keep an eye out for those. Over to you, Ruth Ann.
Well, my really big vision is that decarbonization would be a reimbursable health measure, and that healthcare would see that as an asthma reduction measure for asthmatic patients and those with respiratory disease. That electrification and decarbonization become core in housing code throughout the country. And that every city and every state housing program adopt a whole house approach, so that we do what was the original premise of housing code, came from the health work of Florence Nightingale, and that we put health back into our housing code. So I live in the world of occupied housing because that's where the majority of very low income families in America live and have little access to new housing often. We want them to have that access, but we want people to be healthy where they are. So I will redefine that as green and healthy homes, and say that we want that in the future to be the norm that every child and every senior and every family experiences.
Thank you so much. I have been blown away by today's conversation. I have learned a ton from both of you, and I'm looking forward to seeing more of what you produce and the work that you do going forward. You're doing great work, so please keep it up. Well, unfortunately, today, that's all the time we have for our conversation. I want to say thank you very much to the both of our speakers for joining us, to provide their expertise and their insights, and everyone in the live audience who participated in our conversation. Should you wish to watch this episode again or share it with your friends or your colleagues, you can find it on the Atlas YouTube page, as well as on Spotify, Apple Podcasts, and Google Podcasts. We encourage you to check out our Buildings Hub platform and to join our electrification community today. We hope you catch the next episode of Buildings Hub Live next month. Have a great week, and we'll catch you next time.
We hope you enjoyed this episode of Buildings Hub Live. You can listen to this episode and all other installments of Buildings Hub Live on our Atlas YouTube channel. You can also find us on Spotify, Apple Podcasts, and Google Podcasts. If you're interested in additional content, check out our data, articles, and dashboards at atlasbuildingshub.com. Thanks for joining, and we'll catch you next time.